I would like to acknowledge and pay my respects to the Dja Dja Wurrung country of the Jara people, the traditional custodians of the land we are gathered on today. I would also like to acknowledge those participants who may be on other lands while participating in this event. I would like to pay my respects to their elders, past, present and emerging, and acknowledge all Aboriginal and Torres Strait Islanders here today, and to also pay my respects to your elders, past, present and emerging. We express our gratitude in the sharing of this land, our sorrow for the personal, spiritual and cultural costs of that sharing, and our hope that we may walk forward together in harmony and in the spirit of healing.
Hello and welcome to the 2020 Annual General Meeting for Boort District Health. Firstly, I'd like to recognise those attending today at our first ever virtual Annual General Meeting, including our Life Governors, our Board Chair and Directors, members of the Hospital Ladies Auxiliary, representatives from our partner organisations, our volunteers, our residents, patients and clients, our staff and members of the community. Thank you all for joining us at this event today. We'd also like to note that the following apologies have been received.
It is with great pleasure that we present the Boort District Health Annual Report 2019-20. The outstanding support and direction provided by the Board has enabled another very positive year across the health service. It is an honour and privilege to work with so many, including our wonderful staff, our Consumer Advisory Committee, the Ladies Auxiliary, Loddon Shire, Northern District Community Health, Royal Flying Doctor Service, Murray Primary Health Network, Ambulance Victoria, Dental Health Services Victoria, visiting healthcare providers, consumers and volunteers, all who provide enormous support and dedication to improving the health and wellbeing of our local and surrounding community. We are also very appreciative of the assistance provided to the health service over the past year by the Victorian Department of Health and Human Services and the Australian Government Department of Health, as well as the excellent collaborative partnership arrangements evident across the entire Loddon Mallee Health Network. Boort District Health continues to proactively embrace opportunities to innovate and progressively transform the services we deliver in order to consistently provide safe, high-quality, person-centred care. We remain focused on collaboratively achieving and sustaining the highest outcomes, ensuring a positive healthcare experience for all. Valuing diversity and inclusion, we are focused on ensuring that a supportive, respectful and engaging organisational culture permeates across Boort District Health. Following the announcement in mid-2018 that St Anthony's Family Medical Practice would cease operating the Boort Medical Practice, Boort District Health actively pursued a range of possibilities in order to secure an ongoing medical presence locally. Throughout an extensive recruitment process, our preference consistently remained to attract a provider to operate the Boort Medical Practice independently. Working closely with the Rural Workforce Agency Victoria, Australian Health Industry Group and the Department of Health and Human Services, we focused on ensuring ongoing provision of quality medical services for the people of Boort. To ensure continued access to local medical services, the Health Service entered into an interim agreement with AHIG through to the 31st of August 2019, using locum general practitioners during this time. Dr. Christopher Elise and his family were welcomed to the community at an official ceremony late in August 2019, with Dr. Elise commencing independently operating the medical practice on an ongoing basis from September 2019. Despite 2020 proving to be such an extraordinary and unprecedented year in terms of responding to the global coronavirus COVID-19 pandemic, Boort District Health has continued to safely progress a range of initiatives. On behalf of our board and the entire management team at the Health Service, we are sincerely grateful to everyone, our staff, consumers and all members of the community, for adhering to the necessary restrictions, physical distancing and other health regulations during this protracted and particularly difficult time. Our response at Boort District Health to the COVID-19 pandemic has remained fully compliant and consistent at all times with the advice and guidance provided by the Victorian Department of Health and Human Services as well as the Commonwealth Department of Health. With an overarching partnerships and collaboration approach, our overall strategic direction remains focused on a number of key themes. We are developing and strengthening partnerships with government, community and other organisations in order to increase the opportunities for better health, better access and better care for our community. Highly valuing our partnerships with all stakeholders, the Health Service is working constructively with other service providers across the Bullock, Loddon and Gannawarra area to jointly address a range of priority areas. We are committed to maintaining and enhancing our facilities to provide a consistently safe, comfortable environment for all who access our services, whilst ensuring a safe, secure and integrated environment for our staff. In November 2019, we officially opened both our new co-located 2-chair dental clinic and a new purpose-built maintenance facility, which were both funded through the Victorian Department of Health and Human Services Rural Health Infrastructure Fund. In addition, construction of on-site staff accommodation complex, also funded partially through the Rural Health Infrastructure Fund, commenced in early 2020 and is due to be completed by the end of the year. We thank our board directors, staff and volunteers for their unrelenting dedication and commitment to ensuring that safety and quality remain our absolute priority across Boort District Health by diligently ensuring full compliance is maintained with all applicable standards. Working collaboratively, our focus firmly remains on continually enhancing our services, targeting innovative opportunities for further improvement. We have continued to engage closely with the Royal Flying Doctor Service to enable provision of a specialist mental health services at Boort District Health through the Flying Doctor Wellbeing Program. Hydration and nutrition have also continued to be a key focus area in the past year. On behalf of the board, we would like to thank the Boort District Health leadership team, our staff, and all those who work with us for your contributions during the year. I would also like to thank our community for your continuing support. We look forward to working collaboratively together in partnership with everyone over the coming years to further enhance the health and wellbeing of the Boort community and surrounding districts.
We're filming, are we?
Hi, this is Mubarak. I'm the Nurse Manager at Boort District Health. This video is a short presentation of our activities for the past 1 year. Boort District Health acknowledges the traditional owners of the land, the Dja country and the Jara people.
Hi, I'm Craig Winter. I'm the Director of Medical Services at the Health Service. I've been here for a number of years now and seen many changes in that time. Over the last 12 months, we've obviously been very impacted by COVID, and that's impacted what I do and also how the health service responds. Unfortunately, I haven't been able to be on site for the last 4 or 5 months because of COVID. That's also been an impact. So I've had to manage using Zoom, working off site, and it's really good to be back. I've been back now today for the first time. It's been great to reacquaint myself with everybody, to also meet with Chris, the GP, and all the other staff here. I look forward to continuing doing this. Hopefully no COVID around to impact on what we do. But there's been a lot of preparation that's gone on here, and I think the health service has responded very well in being prepared in the unlikely event that there was COVID.
Our most recent project is the 16 Days of Activism, which we did last year as well.
For the last couple of years, we've all dressed in black. You may recall we've done our Orange Hands project and our White Ribbon project. Our family violence team at the hospital is Marie, Sam, Mubarak and myself.
The Men's Pit Stop project is a collaborative initiative by Loddon Shire and Boort District Health.
visitors, patients, and lots of community members. Orange is supposed to symbolise hope for women who are experiencing family violence.
Let's rewind and start from December 2019.
Thank you to Jono, who has done everything here all on her own. I had one job and I forgot to do it. Santa needs some
On 25th of January 2020, the first case of COVID reported in Australia. As per the CEO advice, Boort District Health set up an incident command center to review and escalate our response as per the department guidelines. We updated our pandemic policy, obtained additional stock, and reconfigured day center as a potential COVID ward. Non-emergency and external services suspended with extensive use of telehealth.
So the nursing staff and everyone else adapted, was able to use technology to continue with my visits.
We were practicing till level 3 restrictions wherein we only saw the emergencies. Later on, as things eased, we went back to level 1. And again, second phase hit, and again we had to go back to level 3.
Boort District Health currently has restricted access to visitors. We are maintaining social distancing.
People of Boort, we are very happy here, and the hospital staff is really looking after us.
During COVID, we've managed to keep the spirits high of the residents.
I'm so happy, and this is the reason why. Stay at home. It's the best place. There's no place like home. When you look at how the world's going, you don't have a choice. You've got to do it.
Oh, these blokes are going to muddy up our bus.
Do I push it?
No, don't push it. Don't push anything.
This year we achieved 100% compliance of all our staffing immunisations for the influenza vaccine. We also endeavour to get 100% vaccination of our aged care residents and some acute.
Not going to be, a blood pressure of 160 is not going to make them time critical necessarily.
And then the top strap. Now the reason for this is because some masks, the bottom strap is a bit tight.
As the activities coordinator at Loddon Place, I've had to adapt all the activities here at BDH. The residents have been very understanding of the changes and that have been put in place during these times. We've had to run activities with less people.
And we had a very emotional Anzac Day.
You still suffer, still the effects of war. We do not celebrate victory or glorify war.
BDH organised a commemorative ceremony on the 75th anniversary of the end of the Second World War. Our veterans received a commemorative medallion and a certificate from the Department of Veteran Affairs in this ceremony.
I understand. I have a certificate for you. I do, and a medal. Come on, old boy. So we have a medal and a certificate for you, Richard. That's for you. This medal's for you, Mary. How beautiful is that? Jack, we're giving you a medal today to say thank you. You did a bloody good job. Thank you, Jack.
You do wear mask in North Pole?
Yes.
Yeah.
Yes.
So how often you sanitize your hands?
Every time I touch my mask, I sanitize my hands.
The staff are just working to help each other decrease some of the workload that everyone has. It's been quite difficult for people. Everyone else's role in the management team is to assist everyone and their well-being, and just to make sure that we've all been able to manage through this pandemic together and work as a team.
This particular activity made the biggest news of all.
They're reminding people to keep creative and reach out for help as a way of overcoming the challenges.
After 5 months in isolation, residents were reunited with their loved ones, albeit from a distance.
Absolutely amazing.
There was a couple of kids in the cars yesterday calling out to their grandparents or great-grandparents, and that was probably really one of the main highlights as well.
Boort District Health have been surprised with a drive-by parade from family and friends. It's the first time some of the elderly community has seen their loved ones in person since the start of the pandemic.
Watched on as a convoy of cars driven by their loved ones passed by.
There's a whole little township there, isn't there? So we wanted staff to be near the residents.
For residents, it was the first time they had seen them in person rather than on video calls.
And we had a very special visitor on Melbourne Cup Day.
Wonderful thing that we were able to have a horse here on Melbourne Cup Day. It's a thumbs up. It's the first time for everything.
You want to sit on it, Joe?
Yeah, I might go for a ride later.
It is a wake here. Quite a party. Let's do it.
We're going to the school to see the children in the book parade.
We're in Boort. We're in Boort. Oh, darlings. Yeah. Oh, look what to see you. Wonderful. How did you organise it?
Today is Aged Care Employee Day, and I just want to say thank you for the awesome contribution that all our aged care workers make to the lives, the health and well-being of our 25 aged care residents.
Just want to say how happy I am to be here. The staff are wonderful.
I really think they're doing a great job and everything's going as well as positively can.
I'd like to thank the staff for the care and also the love that they show to each one of us.
We put their needs before ours. We love them very much. I've prepared a beautiful salad and some sandwiches. I love my job.
I'd like to thank the staff for their good act of looking after us and all the good things they do for us.
Stay safe, everyone.
Got a wonderful staff. I love them all.
I said to everyone, enjoy your nice day.
And everyone have a safe and happy day.
Wonderful staff who are amazing, really. I want to thank them for what they are doing for us at this difficult time.
And we had our Remembrance Day celebrated within COVID guidelines.
On the 11th of November 1918, the guns of the Western Front fell silent after 4 years of continuous warfare.
Country road, take me home to the place.
The Garden musical was equally loved by the residents and the staff.
Take me home.
Blue, green, red and black.
I don't know much about Halloween. What is Halloween anyway?
The Are You OK is a really important day.
It's 40 days today and we're making free cappuccinos and lattes and drinks for all the staff and the residents here at Boort.
This is our first time of doing the Boort show because it was cancelled because of COVID this year. So between the staff, the residents and Mary's and her Year 7 children, we've put on this show which the residents have thoroughly enjoyed.
We are delivering Meals on Wheels today. We've got some soup. What else do we need, Michelle? To the residents' home and all good.
I find the Meals on Wheels very good and I hope to continue the service.
We go to the community every day, Monday to Friday. We see about 6 to 9 people a day, only dressing changes, blood pressures and general welfare checks.
10 years service, only in March. 20 years service. That's fantastic. So 20 years.
20 years! Oh my gosh! Thank you! Thank you! Oh, that's awesome! Great!
this is a Boort District Health Accommodation project. We started building in March 2020. Hopefully we'll be finished early January 2021. It's taken a little bit longer this year due to the COVID holding up some of the equipment and supply.
Our biggest project is coming on is the Healing Garden, which we are Auntie Marilyn with on the Zsa Zsa Warung. Our consumers involved in the signage for Boort District Health, which is now finalised.
Well, what a year. Boort District Health full of COVID warriors. All our great activities, as well as 542 presentations in our urgent care centre was business as usual. Over 600 COVID swabs. 300 community, 200 staff, and over 70 patients and residents, all swabbed, all negative. Great effort, great year, well done team. A successful accreditation of our imaging, our mobile X-ray unit, OPG machine and dental.
Thank you everyone for previewing our film here. It's been an incredible year, 2020, and looking back at the remarkable achievements our staff and our community have been able to make, despite the enormous threat and terrible situation we're faced with COVID, have managed to come through it in shining colours really, and it's a credit to everyone that they've been able to embrace such positive energy and move ahead despite those threats that we've all faced. And it's been an enormous pleasure to be associated with everyone here while they've continued to provide the highest standards of care. And I'd like to thank our staff, our board, our community, and everyone associated with Boort District Health for what you've done to make our year an incredible year for everyone. Thank you very much.
Thanks, Darren, and thank you to the Boort District Health team. That was really an amazing presentation, and I just think on behalf of all of the board members, we would just like to say how proud we are of all of the efforts of every single person across this year. It's been really outstanding and incredible to watch all of the efforts and energy that's gone into the work that's happened, particularly in the last 8 to 9 months. During this part of the annual general meeting, we're just actually opening up the floor for any comments or feedback or questions from people who are attending. And so if you could just indicate if you would like to, you could go to the reactions and just either put a thumbs up or a wave, and then we'll be able to get Julie or Kathy to unmute you, and if you're able to, you could turn your cameras on for us as well. That's thank you. We might get Julie to continue on with the rest of the presentation, if we could, please.
I would like to ask you to join me in a vote of thanks to our amazing health service team who have worked really hard, particularly in the COVID restrictive environment, to really provide an amazing support and service to our service users and the wider community. I would like to thank the community for actively participating in the events that have been coordinated throughout the year. Thank you very much to everybody for making what was a very tough and difficult time just that much easier for everyone to bear, and for putting so much effort and energy into the activities that were coordinated. Well, that brings us to the end of our formal proceedings for the evening. COVID-19 has required us to find innovative ways to deliver our services, this being one of them. I would like to thank everyone for participating in this unusual way as we conduct our annual meeting and present our annual report. We have appreciated the community's ongoing support and flexibility, particularly as we have adapted the ways we have operated in response to the changing circumstances. Looking forward, we thank you for your continued and ongoing support in the coming years. Good evening.